slide to sort of summarize. So we said most of the calcium comes from the ECF. It comes into the cell. It triggers more calcium from the SR here. That binds to calmodulin, which turns on MLCK, and we can have the phosphorylation of the myosin heads, which leads to muscle contraction. And if we don't have calcium, right, calcium is not being shown here, but understand if we don't have calcium, we drive this in the other direction, where we unphosphorylate those myosin heads, and we lead to muscle relaxation, okay? All right, now, in order for the smooth muscle to relax, we need to get rid of that calcium. And so we have two mechanisms to do that. We have this calcium ATPase pump that is on the SR membrane, pumping the calcium back into the SR, but we also have this calcium-sodium countertransport that's allowing calcium to move into the cell according to its ECDF, and we're going to take that energy, right, this is secondary active transport, we're going to take that energy and drive calcium to move in the opposite direction against its ECDF, okay? So understand that both of these ions want to get into the cell. They're in higher concentration outside. And so when we bring sodium in according to its gradient, we can generate energy to move calcium against its gradient and kick it out of the cell. So we have the calcium ATPase pump on the SR and the calcium sodium countertransport, which is secondary active transport on the cell membrane itself, okay? And so the contraction time in smooth muscle is going to be a lot longer than we see in skeletal muscle. We're going to have a slower, longer, more sustained contraction. We talked about that, and we talked about why, okay? All right. We also want to remind ourselves here of the involvement of the autonomic nervous system. Okay, we talked extensively about the autonomic nervous system, and we know smooth muscle is one of the primary tissues that it innervates. So we have both the sympathetic and the parasympathetic influence on these tissues, right? So the rest and digest versus the fight or flight. So we can either excite these tissues or we can help these tissues to relax. Now, we'll talk about what tone is in a little bit, but in some smooth muscle, even if we do not excite these tissues, they have the ability to contract on themselves. They have that natural tone. And I'll talk about that in a couple of slides down. So we can excite or inhibit these tissues, which will help them to relax or to contract, okay? And so it's going to depend specifically on the receptor types, right? What receptors are we speaking about here? What receptors are we speaking about here? Smooth muscle, autonomic nervous system, what receptors are we talking about? Adrenergic receptors, right? Alpha 1, alpha 2, beta 1, beta 2, beta 3. Depending on what specific example in the body, we're going to see one of those receptors, and that's going to dictate what exactly it's doing. We talked a lot about that, right? Whether it's going to excite its second messenger or its tissue, or it's going to inhibit its second messenger or its tissue. So make sure you're making that connection here. We also mentioned, again, extensively about the presence of varicosities here. So we don't have that neuromuscular junction, we don't have that nerve terminal. What we have are varicosities that are releasing this neurotransmitter. What's the neurotransmitter in question? What's the neurotransmitter that's in question here? So this is the autonomic nervous system, smooth muscle. This can be acetylcholine or norepinephrine, right? So it can be either of those depending on whether we're in the parasympathetic or the sympathetic. And then that's going to diffuse and bind to its receptor, which is on this cell. That's going to bring about the membrane potential change. And then we get to this step. Okay, so understand what precedes this step. We talked about it before, but don't sort of compartmentalize. Make sure you're connecting what precedes this step with all of those various receptors, and then how we bring about smooth muscle contraction here. Okay, so let's classify smooth muscle. Now we talk about two different types of smooth muscle. There's single unit smooth muscle and there's multi-unit smooth muscle. So I'll just sort of describe them loosely and then we'll talk about some examples and such. So multi-unit smooth muscle has each individual cell being innervated by a varicosity or by a postganglionic neuron. So basically we have each cell acting as its own individual unit here. Okay, so they're individual, they're not connected via gap junctions. And so if we innervate one cell, we can allow that cell to contract, we can allow a neighboring cell to contract, and we can sort of recruit additional cells, just like we saw with skeletal muscle. In single unit smooth muscle, all of the cells are acting as a single unit. We cannot recruit here because everything is already sort of at the party, right? There's no recruiting happening here because all of the muscle is acting as one single unit. We have gap junctions that are linking these cells together. And so they're really communicating. They're contracting synchronously as one entire unit, whereas multi-unit smooth muscle is acting as its own individual cell. We can have one cell contract and the other not contracting. And as such, we can recruit additional cells to contract. All right, so let's look at some examples here. So the most common type of smooth muscle we see is single unit. We see this in the intestinal tract, in a lot of blood vessels, more smaller blood vessels. We see it in the respiratory tract. And if you think about it, these are areas of the body that we want to be contracting as a single unit, right? We want the entire GI system to be contracting together, right? We don't want that sort of individualized contraction. And so these are some of the examples that we see single unit smooth muscle. Now these fibers, again, are linked by gap junctions, and that helps to transmit the chemical impulses here. So if we activate one cell, we excite one cell, it can communicate to its neighbor really quickly through these gap junctions. And that is what allows the entire muscle to act as one unit, the gap junctions that are connecting. Okay. Now, we also see pacemaker potentials with these types of cells. So these cells have the ability to spontaneously depolarize. And I sort of indicated that earlier, but that gives this level of contraction that has no external stimulation. So in the absence of any neural stimulation, any hormonal stimulation, any chemical involvement, these cells have an ability, almost by magic, to contract on their own, okay? And that is what we call a spontaneous depolarization or a pacemaker potential. We'll talk about that again in a bit. So that is tone, this level of contraction where if you do nothing to a smooth muscle cell, a single unit smooth muscle cell, it will contract on its own, okay, in the absence of stimulation. We also see increase and decrease tension here, which again is natural. We can increase the amount of force generation. We can decrease the amount of force generation that's seen with these cells. We have the stretch reflex that we see with these cells. So again, examples like the respiratory tract or the gastrointestinal tract, we see this stretch reflex where sudden prolonged stretching of these cells causes the entire unit to relax. And that's what we see with the gastrointestinal system. I said relax, but I did this. Relax, right? So when we ingest food and we stretch the GI system, we stretch those single unit cells, that causes the muscle to relax to sort of accommodate more food, right? That's the stretch reflex. We also see graded contractions here, meaning that we can have small contractions, medium contractions. We can recruit additional cells to make stronger contractions, okay? So that's what I mean by that decrease, increase tension. Because we cannot call on additional units, all of the cells are sort of contracting as one unit, okay? Based upon varying intracellular calcium levels. So if you want a strong contraction, we bring in more calcium. If you want a weak contraction, we bring in less calcium. That's how we can sort of grade these contractions. Multi-unit smooth muscle, alternatively, we see this in the large airways, the large arteries, so not the smaller arteries, but things like the aorta, the vena cava, those really big vessels, the ciliary muscles and the iris in the eyes. And these do not have gap junctions. They have little to no gap junctions. And so each cell is acting as its own individualized unit. And as such, we can see recruitment. Each cell is being innervated individually by a varicosity on its own. And so we can call on additional units to help these muscles generate more force. We do not see tone with these types of smooth muscle. We do not see pacemaker potentials. So they cannot spontaneously depolarize and they are innervated individually, basically. So innervated individually, no tone exhibited, and we can see recruitment. Now, as we notice, there are no gap junctions, and that is just indicating to us again that these cells are their own individual units, okay? All right, now in terms of smooth muscle here, in terms of pacemaker potentials, Smooth muscle, specifically the single unit smooth muscle, we also see this with cardiac muscle. We'll talk a lot about it going forward, but these cells have the ability to spontaneously depolarize. And when I say spontaneously depolarize, in the absence of hormonal stimulation, in the absence of chemical stimulation or neural stimulation, these cells can spontaneously fire an action potential. We did not see that with skeletal muscle, okay? We did not see that with neurons. Neurons generate an action potential by the firing of that action potential and by the chemical and electrical synapses at the junction. Here, these cells resting on their own can spontaneously depolarize and fire an action potential, okay? Now we have two types of potentials. We have a slow wave potential, which is basically these cyclical raises in the membrane potential. So not enough to really spike any meaningful change, but just these oscillating changes in the membrane potential, right? These slow wave potentials. And then more importantly, we have pacemaker potentials. Now these have enough current, so to speak, to actually do work. These are synonymous with an actual action potential. And so we fire enough of a membrane potential change to do some meaningful work. And this is what we call a pacemaker potential. Again, we see this with single unit smooth muscle, not multi-unit, and we see this with cardiac muscle. We'll talk about the